Thank you for giving me the chance to talk to you about hospital-acquired infection. According to the Canadian government, of the people that get admitted to a hospital room in Canada, 220,000 of them every year get infected from the bugs that are in those patient rooms. According to the CDC in the States, it costs our hospitals $26,000 per patient to bring them back to good health. They also stay in the hospital an extra 10 days or 11 days, which could speak to the fact in many cases of gurneys in hallways. Of the 220,000 patients that get infected, 8,000 of them die every year. That means they're dying before their time. That means that people that walk into the hospital to have tests or minor surgery, whatever done, leave in a body bag, feet first, every year, which is an intolerable situation, especially when you think about the fact that my immune system, for instance, is 84 years old. And if you're 70 years old, then that's how old your immune system is. And that is a scary thought, isn't it? 10 years ago, two eminent Canadian doctors, Dr. Michael Shannon, who was the former Deputy Surgeon General of Canada, and Dr. Dick Zoutman, professor at the University in Kingston, and presently the Chief People Officer at the Quinte Bay Health Group in Belleville, 4 hospitals. These two doctors got together 10 years ago, and I'm sure it must have taken them a long time to come up with the exact balance of ozone and hydrogen-peroxide. They put these chemicals into what would look like a big humidifier on wheels. They wheel the machine into an empty patient room. They seal up the door, they turn the machine on, and an hour and a half later, 99.9999% of the bugs in that room have been killed, eliminated. The room is completely disinfected, sterilized, if you like. The sterilization can last for a year unless some dummy brings in fresh bugs. The thing is, this system was invented by these two doctors 20 years ago. And as of this date, not one of these machines has been sold to any hospital in Canada, for that matter, around the world. And that has to make you wonder a little bit when you figure that, well, I know that when the time comes, as it inevitably must, that I have to go in the hospital for whatever, there isn't one patient room that I can book into anywhere in the world that isn't covered in bugs. You can't see them, but they're there, and they kill 8,000 Canadians every year. They kill 100,000 American citizens every year, and somewhere between, I don't know, it could be 1 million or 2 or 3 worldwide every year. And yet this wonderful Canadian invention has never been used to solve the problem. So I intend to do it myself. I have a plan. The plan is fairly simple. For the last 2 months of the year, I will be on the phone and I will find, thanks to the law of averages, I will find some hospital management people that agree to get together, form a company, and lease a machine, this wonderful machine that is guaranteed to eliminate pathogens in an hour and a half. Starting in January, there will be 2 groups of people backing up this hospital group. One group will be students from Ryerson, George Brown, U of T, whatever. They will be the ones that will be pushing the machine around the hospitals and disinfecting them. The other group will be people my age, or people in their 70s and 80s, who want to do something worthwhile for about an hour a day to keep up their self-respect. So they will be on the phone talking to big hospitals and offering to disinfect patient rooms in big hospitals in November and December of 2018. So, for the first 10 months of the year, the students will be disinfecting the 2,000 patient rooms that the group controls, and at the same time, they will also be calling, or rather organizing the students so that the 200 patient rooms get disinfected every month for 10 months. When a big hospital decides that they want to have their patient rooms disinfected, they will agree to pay $1,000 per room and $500 up front. And that is what will be the cash flow to pay the leasing payments and to pay the students and to pay the retirees that organize the students and find new big hospitals that want to get their rooms disinfected. And I think my time is probably up. So all I can say is that this is, if you're interested, because it affects you directly, your wife, your parents, in some cases grandparents, and it's not a problem to be ignored, as it has been for the last 10 years. So I have a website. If you care to look at it, it's www.HospitalAcquiredInfectionCanada.com. And I want to thank you for hearing me out.